Hello guys, D'Angelo and welcome back to EMGT. Today I wanted to go over the patient assessment, but I will split it into two videos. For this video I will talk about scene size up and primary assessment, and in the next video I will talk about the secondary assessment since it has more steps than the other two, but that's for the next video to worry about. Anyhow, let's start off with scene size up. Scene size up is the first part of the patient assessment and dare I say the most important, because as an EMT the most important thing is you 1. Because you matter, and 2. The patient needs you to be well in order to treat them. If something bad happens to you, a patient who is in a disastrous situation might not make it, so this step is always important. For scene size up, the steps for this are: first, you check if a scene is safe. No matter if you are told by police or anyone else, you always make sure you check if your scene is safe, because if you get an injury you become a liability and another patient. So always make sure you check if it's safe. Next, you find out MOI, mechanism of injury, or NOI, nature of illness. To quickly explain, both mechanism of injury is an outside force caused damage to the body, while nature of illness deals with something on the inside of the body damaging you. Best way to remember which is MOI deals with things like stab wounds and NOI deal with common house cold. Reason to know what it is because that lets you know what you do for your secondary assessment, which again will be explained next video. Third thing to do is to know the number of patients. This is good to know because you might need help from more EMT, AEMT, or paramedics just in case there is more than one patient. Which would tie in with the fourth thing, additional resources. While more EMTs is one thing, you might also need more items in case a patient is in a critical state and you run out. And running out of and not having any kind of backup could lower a patient's likelihood of survival in that kind of situation. Fifth thing is BSI, body substance isolation, which is another way of saying PPE, personal protective equipment. BSI or PPE is basically the way to protect yourself and your patient. What is it? Are the things you wear to prevent anything that the patient has to spread to you and in turn you spread it to someone else. Items you wear for this are gloves, mask, gown, and face shield. You don't have to wear all these things, but it's important to always wear gloves. Last thing for scene size up is stabilization of the spine. For this you determine if the patient needs to have on a C-collar, which is important because if a patient has a spinal injury the C-collar will help stabilize or keep the spine in place so it doesn't shift out of place. Well, next is primary assessment. For the primary assessment you are checking for immediate threats, but in order to do so you have to first start off with general impression. General impression deals with what you can see. Afterwards you then check for level of consciousness, which is done by the process AVPU, which stands for alert, patient is awake and aware; verbal, patient only responds when you speak to them; pain, patient only responds when you slightly pinch them on the shoulder; and unconscious. Once you determine what level of conscious the patient is, you find out what the chief complaint is. Chief complaint is the main problem or reason you are at the call. Once you find out what it is, you gotta do is ABC. Yeah, I like Jackson 5 song, but back to topic, you have to ABC, which stands for airway, breathing, and circulation. For airway you check if it's open and clear. Breathing you check if the patient chest rises and falls, and if there are any abnormal noises when they breathe. Finally, for circulation you check if skin and temperature are normal and if they are getting moisture. Finally, once you dealt with any life threats you determine if you need to transport the patient to the hospital or if you don't have to do so. Well, that is all for scene size up and primary assessment. Sorry for primary assessment, there wasn't a lot to say, but I hope this helps you understand the first two parts of the patient assessment. Anyway, I hope you enjoyed the video and hope, again, that this helps you if you are trying to become an EMT also. I want to apologize that it took me a minute to come back and make a video. Well, hope y'all have a great day, and if you haven't already I highly recommend you join the Discord. Link in description and will be in bio. Anyway, see y'all later.